Good afternoon, everybody, and welcome to the Devon Alliance webinar. So I've got great pleasure in welcoming two colleagues from South West Ambulance Service this afternoon. We are very excited to be working with them collaboratively on some great opportunities for international nurses. So I'd just like to introduce Cara.
Hello, I'm Cara. I work at the South West Ambulance Service. I'm a Learning and Development Officer at the moment at the Trust, and I have a nursing and a midwifery background.
Lovely, thank you, Cara. And Tom?
Hello, my name's Tom. I also work for South Western Ambulance Service, and I am the Recruitment and Retention Lead for the Emergency Operations Centres.
So we're very excited to be advertising at the moment for international nurses to come and work for South West Ambulance Service. So it's also known as SWAST. So when you hear that, that's the abbreviation. So for nurses that have got that acute experience and are looking for that career development pathway in call centres, this is going to be a great opportunity for you. So Tom's going to talk about SWAST as an organisation. So I'm going to hand over to Tom. Thank you very much.
Fantastic. Thank you very much, Carly. So good afternoon, everybody. My name, as I said before, my name's Tom Wilkinson. I am the Recruitment and Retention Lead for the Emergency Operations Centres. So the presentation today, we're just going to cover off some key areas, which is what is the role of the Emergency Operations Centre triage clinician, the work streams, the training and support that you have available to you, career progression, and also who are we as an organisation. So who are we? So we are South Western Ambulance Service, and we have a responsibility for 20% of mainland England. We cover the counties of Cornwall, Isles of Scilly, Devon, Dorset, Somerset, Wiltshire, Gloucestershire and Bristol. As you can see on the map in front of you, this is shown quite clearly. This is a map of the UK, and our area that we cover has been highlighted in red. So we cover 20% of mainland England. So in terms of the trust then, so in the year between April 2021 and the 31st of March 2022, the trust managed on average just shy of 1.1 million incidents across the whole of the Southwest. During that same period of time, we received 1.2 million 999 or 111 calls into the service, which averages out at around 3,500 calls per day. Within the emergency operations centres, we have two sites, one based in Bristol and one based in Exeter, and we have 250 colleagues working across both emergency operations centres. The emergency operations centres is made up of a combination of workforce. This is 999 call handlers, so these are the people at the front end of our service answering those 999 calls as they come in. We also have our dispatchers who are responsible for our operational resourcing and ensuring that that patient gets the right resource at the right time. We have clinicians, such as this particular position, again responsible for triaging all of those calls that come into the service and finding suitable alternative pathways. And then we also have both clinical and non-clinical leaders who are responsible for operational delivery and performance. So before I hand over to my colleague Cara, I'm just going to play a little bit of a short clip around the role of a EOC triage clinician.
Hi, my name's Julie. I am a qualified nurse midwife, and I currently work as a triage clinician within the Emergency Operational Centre, South West Ambulance Service. My role contributes to quality care in providing a robust clinical assessment to ensure that each individual gets the most appropriate care, the most appropriate time. So a day in the life of a triage clinician is very varied. So predominantly we are going to be dealing with the clinical stack. So that would involve looking at the different categories of calls that are waiting for a response. Also looking at the low acuity calls that are deemed initially as not needing any response. However, through clinical assessments, things change quite significantly and quite quickly. There are lots of different work streams. So sometimes we're not just clinically, triaging over the phone. We can be supporting when the calls are coming in initially. We can be supporting the dispatch team as well. So it's a very varied role and no 2 days are the same. We're a very diverse team, huge clinical experience within each EOC. So there are nurses, there are paramedics, we have trainee specialist practitioners, as well as hub doctors. We have honorary midwives who are in the hub, and also we have a large mental health specialist desk. So there's lots of clinical knowledge. Every day is a learning day. I enjoy working for SWAS because it is quite dynamic, it's ever-changing. We are a very busy organisation, so there are lots of different things going on from day to day. I enjoy the team I work with. We are very close but very experienced clinical team. It's just a very good environment, really. For the clinicians EOC, the shift patterns are really quite variable. There's about 8 different shift patterns. There are flexible working. It would be really dependent on what your requirements are. So in my experience, the leadership's very supportive. There is an open door policy, regular monthly one-to-ones with my manager. Just sort of open door any issues at all that I feel that I can always go to my leadership team and discuss. One of the deciding factors for me to come over to the South West Ambulance was career progression, really. Nurses are becoming much more recognised within the ambulance service. Our skills are acknowledged and they are very well received. I think it was an area that I personally knew that I could progress with educationally and the training and the audits, which is what I enjoy. The other side of my job is one area that you probably can make a difference, isn't it? So if I can spend 10 minutes assessing a patient, doing a full robust clinical assessment and ensure that I've got the most appropriate care for that patient at that time, then you're going to get some satisfaction from that.
Fantastic. Thank you very much to our esteemed colleague Julie, who pulled that video together for us. So I'm now going to hand over to Cara to talk a little bit more about the role as a triage clinician.
Thank you, Tom. Okay, so my name's Cara and I'm a Learning and Development Officer, as I said, within the EOC, within the Emergency Operator Centre. So I am going to talk a little bit more about who we are. So as Julie said, we're a multidisciplinary clinical team. So we've got paramedics, nurses, some midwives. We also have specialist practitioners that come into the hub, doctors. We also work very closely with mental health practitioners who work on a mental health desk fielding those calls. We also have the clinical leadership team within the EOC, and that's made up of lead clinicians, clinical team leaders, and then our deputy head and head of the EOC clinical operations. So each shift on the clinical support desk will have a CTL and a lead clinician, and they're responsible for the general oversight of the CSD clinicians, and they also liaise with other management teams within the EOC. Our mental health professionals at the moment are based in our Bristol EOC, and they triage mental health related calls across the whole trust. They also, within certain areas, have their own rapid response vehicles, which will go out to attend calls within the BNS SG area. So that's Bristol, North Somerset, and Gloucester area. We work alongside honorary midwives, so they're based in the Exeter EOC, and they will deal with calls relating to patients from their trust, but they also provide advice to the CSD clinicians about maternity related jobs. We also do have dual qualified nurses and midwives within the trust as well, so they're also available. And that's really one of the strengths of the EOC, is that we do have a very strong multidisciplinary team. We can, use each other's experience and knowledge as required. If I could have the next slide. Thank you. So we've got a number of roles within the EOC. A lot of our work streams are, so the main bulk of our job is clinical assessment. So using a triage tool combined with our clinical knowledge, we assess patients. We do this remotely. So as Collie said, we're in a sort of a call center based setting. We don't work face-to-face with patients. However, using the telephone and also use of video consultations allows us to do a full clinical triage. This can help us to make sure that we're getting the right care for the patient. We use several different directories online to help us find suitable or alternative care pathways for the patients. So it means that patients get the right care in the right place at the right time. We also care pathways. Sorry, I've said that one already, haven't I? So we're also available to provide support within the EOC to other members of staff, other colleagues within the EOC. So we've got our EMDs and our dispatchers, and we're also here to advise them if they've got any concerns that they might want to ask us about. Specific work streams that we cover, we categorise calls that come into the ambulance service depending on clinical need. So category 4 and 5 calls. Category 4 calls can be hospital admissions arranged by GPs and other healthcare professionals. Unfortunately, they can wait for longer periods of time sometimes, and so we review these calls frequently to make sure that they're still getting the most appropriate response. Category 5 calls are automatically go into the sort of clinician's desk. So all of these calls will be triaged by a clinician, and following that triage, we can make sure that the patient's getting the most appropriate response, whether that's seeing their GP, whether it's going to see their own midwife potentially, or an ambulance response. We also review category 2, category 3 and category 1 calls. Category 1 calls are our highest level of response calls, and we will assess those to ensure that category 1 responses are going to those people that need immediate and life-saving interventions. We have a couple of other work streams that we work on as clinicians within the EOC. The referrals clinician is specifically looking at the stack, and we work very closely with other clinical assessment services within the Southwest. These clinical assessment services we can refer patients within that area to these services, and they can assess them further to determine the need for an ambulance response. So our referrals clinician will be working through our stack of calls and making sure that those appropriate calls are going to those other services that we work very closely with to make sure that the patient's getting the right response. A dispatch clinician will work with a dispatch assistant, reviewing calls, seeing if there's alternative transport that's available in times of high demand. If I could have the next slide, please. Thank you. So we're really lucky in the EOC. There's lots of training and development opportunities that are available to us here. So we've got the learning and development team, and they will help to obviously, inducting new clinicians into our team, but also making sure that we're getting that continuous learning and professional development as well. We are very lucky in the EOC that we have an educational bursary available to each of us, and that can be spent on areas of particular interest for clinicians. We have a really wide range of CPD as well that's available to us, whether that's in-house training or university courses through external providers. We also work quite closely with patient support groups, and they provide training for us as well, so that we, we're making sure that we're getting that patient experience. So we're really, really lucky, and that's one of the reasons that I love working here, is that there is a strong learning and development focus with lots of opportunities available to us. In terms of career progression, we have a number of roles which clinicians can progress onto or within. So we work as EOC clinicians, and then there's the opportunity to progress to the senior or a lead clinician role. We also have clinical team leaders, the learning and development team, lots of opportunities for career progression, both clinically and within the leadership teams in the EOC. And so if we go on to the next slide, thank you. I just thought I'd talk a little bit about induction and preceptorship within SWAST. So everybody goes through the same process when they're new to our trust. We have our trust induction. We have a period of time where we become familiar with all the software that we use, all of the different programs that we make use of in order to help us do our jobs. We also work alongside and can have observational shifts working alongside the other roles within the EOC. So we can we allow that time for candidates who join us to spend time with the EMDs, with the call takers, with dispatcher, so that we can become familiar with how each role works within the EOC. You then have a period of supported practice. This would be, listening to clinicians within the various work streams, triaging calls. We have a preceptorship skills passport that we'll complete with you, and this allows us to, have a framework for that learning, making sure that we're meeting regularly and covering both familiarization with the role, but any concerns that you might have, or areas of identified areas or objectives that you've also got. We would then, there's also, as I've spoken about, the various options for role progression within the EOC. Lots of support available, whether that's from the learning and development team, from the clinical team leaders, from the clinical leads. So there's support available on a shift basis, on a preceptorship basis, and also the peer support of your colleagues. I have to say that it is a very, very friendly team here, really supportive. Everybody's been in the same boat before as a new member of staff within the team, and everybody really is very helpful. It's a really supportive environment to work in. And I think that's everything that I was going to say about that. I don't know if anyone has any questions about that, or
yeah, lovely. Thanks both of you. That's been really helpful and really informative. So I've got a couple of questions. So just going on from the induction and that preceptorship, that sounds like a really sort of supportive package there for new recruits.
Yep.
So I know that this role is slightly different in that they would arrive and be paid a band 5, and then on receipt of their PIN they would go into a band 6. Is that correct?
Yeah, that's true. So yeah, we're a specialist role within the ambulance service, and that's recognised as a band 6 position. We work with our colleagues, but autonomously, making clinical decisions, ensuring that patients get the right care. So it's a band 6 position, and then, as I've said, there is the opportunity for role progression as well, whether that's band 7 within the clinical lead, senior clinician team, learning and development team. There is other options there for role progression.
So that's really exciting, because it's very unusual to have that clear pathway on arrival straight to a band 6. So if the candidates can get their PIN number do their OSCEs, get their PIN number. They could be in that band 6 within the first 4 to 5 months. So that's perfect for those candidates that are coming over with a lot of acute experience. So that's really exciting. So another question I just thought of is, so I'm a nurse. I've never worked in a call centre. I've always worked on wards, clinical areas, acute areas, etc. So give me an example of what you would do during a conversation. So, for example, I've listened to your talk about the different categories of calls that you have to deal with.
Yep.
So, if you've got a Cat 5 call, so that's something quite serious. So, if I'm Mrs. Smith phoning in and someone's taken my call and it's been handed to you as a clinician, what sort of things would you ask me or speak to me about?
So our category 5 calls are what we consider the lowest acuity calls.
Right, okay.
And they will always automatically be for clinical triage.
Yeah.
So the call takers do an amazing job, but they are very limited in what they can ask and how they can triage patients or callers. So being a clinician, we use a clinical support decision tool. So we use a triage tool in order to help us get the information that we need, carry out that clinical assessment, and then using our clinical skills, knowledge, experience, formulate a plan for the patient. So, for example, you might have, each call will have a small amount of information with it. Sometimes you get a lot of information, sometimes you don't. It might have the age of the patient, what they're presenting with, vomiting, and that might be it. You might get more or less information.
Okay.
You might have a call where somebody's had a fall and they've had an injury. So we're very prioritization focused. So what's the most serious thing that we need to be aware of? We use MTS at the moment, but there are other clinical support tools available that we use to triage that call. So asking what is the clinical presentation of the patient, that helps us to make a plan for that patient. So depending on the outcome of that triage, it might indicate that the patient needs an ambulance response. And that will help us with our clinical skills, knowledge and experience, what kind of category response that patient might need. Or actually, as may be the case, a lot of the calls are appropriate to go to the GP. Potentially the patient might need to go to the emergency department, but it's safe and appropriate and, better that they make their own way to the emergency department.
Yes. Yeah. Okay.
And then obviously, a large part of our role is providing clinical advice to patients as well. So assessing pain, managing pain, taking into account the patient's past medical history, medications, etc.
I see. Okay. So there could be lots of, dependent on that patient, will depend on what the advice you give. So it could be go to the GP, go to the pharmacist, because there's a lot of treatments pharmacists can give in the UK, isn't there? That's not necessarily need to be seen a GP for. Okay, that's interesting. So, and then the only other question I've got is about the health and well-being of staff with SWAST. So what sort of support would an international nurse get if they were successful in these positions?
So we're really lucky. I'm going to take that question, if I may, Cara. So we're really fortunate within the emergency operations centres, specifically within the clinical team, because we are such a tight-knit team. I think one of the biggest areas of welfare and support is the fact that we are a multidisciplinary team with significant skills and experience, and as such, we are like one big family. We are the emergency services is always seen as that sort of green army, so to speak. And we all, we have that space and capacity to share learning, to share experiences, to have that really open and honest dialogue with clinician to clinician, colleague to colleague, friend to friend. So that's really exciting. Aside from that, obviously, as a service, we have some really exciting sort of support services available. We have our own occupational health services. So for those that need additional support, additional adjustments at work to support them to fulfill their role, we can sort that out for them. In terms of your own sort of mental health and well-being, we have a fantastic staying well service within the organisation, and that is made up of a combination of well-being practitioners, counsellors, mental health practitioners and social work colleagues. and they are there purely to support us as a workforce. You know, they are specifically designed with ambulance sector in mind. So they're aware of the role of a clinician is very varied within the trust. You can go from, like you've just alluded to, Carly, little old lady, 87 vomiting, to actually traumatic cardiac arrest or traumatic road traffic accident. And along with that, one of the biggest areas of welfare concern is that vicarious trauma, in terms of only being able to hear what's going on and not actually be there physically present in the room to deal with the incident as you would normally do as a clinician. So as such, we have specialist trained mental health first aid colleagues. We have what's known as TRIM, trained practitioners and managers. So TRIM is trauma risk incident management, and that again is a fantastic supportive tool for those individuals that have been through a significant event or significant incident. We have specialist trained colleagues that can sit down and talk you through that whole debriefing process. And as I said, aside from that, we also have people like Cara who are specialist clinicians. You know, Cara's a dual trained nurse midwife, but she also has another role as a clinical learning and development officer. So whilst, yes, predominantly her role is educational, a lot of her role is also the pastoral support element in terms of supporting you. You know, when you come into the role, you're going to have a lot of questions into why, what does this mean? What does that mean? I don't understand this. I don't understand that. God, this is all confusing. Actually, the role of Cara and her fantastic team, again, made up of a multitude of different professions, are there to guide you through that step one by one and answer those questions that you're not quite sure about.
That's really good. And I'm just thinking when I was listening to you then, like in a position like this, you're never on your own, are you? Because you're in a room with other clinicians that are taking calls as well. So in terms of support, it's fully supportive. But no, that's brilliant. So you know, for candidates with acute experience, I think this is something that they need to consider. The career pathway is there and in place. Obviously, just because of the nature of the job, it needs to be candidates that are very confident with their listening and speaking skills, because a lot of it is based on the phone. And I know the teams you're recruiting from are Exeter and Bristol. Is that correct?
Yes, it is. Yeah.
Yep.
Lovely. Brilliant. Okay, that's great. Well, thank you both so much for coming along and talking about these opportunities today with me. I'm tempted myself to apply. It sounds really exciting.
I would definitely encourage anyone who would be interested to do so. I've never done a job where I've dealt with such a variety of presentations, and that really is one of the strengths of the job, is you never know what you're going to be faced with. So there's massive opportunities to learn and become more familiar with the, just increase your medical and healthcare knowledge. And I'd never done this kind of a job specifically like this before I joined the EOC, and it has improved my clinical decision making in a way that I never really thought that it could do. It's made me such a better clinician and a better practitioner, which is something that I'm really grateful for. And I think, because we have such a unique role, we really do get to make a difference to patients' lives. That, that individual person, that patient that you're speaking to on the end of the phone, using all of those other resources, we really do have a great opportunity to make a difference. So I would welcome everyone and anyone. If you think that this role is of interest to you, get in touch and find out a bit more information. We'd love to hear from you.
Wonderful. Thank you very much. Okay. So as Cara's just said, get your application forms in. We will be arranging interviews in the new year. And stay safe and have a good day. Thank you, everybody.
Thank you.
Thank you.